Hi everyone, welcome back to my channel. In this video, we'll solve some HCPCS Level II practice questions for CPC exam. Let's start with the first question. A 35-year-old female is getting a levonorgestrel implant system with supplies. The HCPCS Level II code for the implant is, let us check the options. Check option A, S4989. S4989 is for contraceptive intrauterine device, including implants and supplies. Check option B, J7306. J7306 is for levonorgestrel contraceptive implant system, including implants and supplies. In the question also they have mentioned levonorgestrel implant system with supplies. Therefore, option B, J7306 is the right code. We'll eliminate other options. Option A, S4989 will be wrong because that is for contraceptive intrauterine device. That is not mentioned in the scenario. And in option C, A4264 is for permanent implantable contraceptive intratubal occlusion device. So that is also not matching with the question. We'll eliminate option C. And in option D, J7301 is for levonorgestrel releasing intrauterine contraceptive system 13.5 mg. But in the question they have mentioned levonorgestrel implant system with supplies. Therefore, we have to code J7306, not J7301. So eliminate option D. Read the question. 10-year-old male sustained a Coles fracture in which the pediatrician performs an application of short arm fiberglass cast. Identify the HCPCS Level II code that would be reported. Let us check the options. Check option A, Q4012. Q4012 is for cast supplies, short arm cast, pediatric, 0 to 10 years, fiberglass. And in option B, A4580 is for cast supplies, example, plaster. And in option C, A4570 is for splint. And in option D, Q4024 is for cast supplies, short arm splint, pediatric, fiber, glass, 0 to 10 years. So which among these four codes is the right one? The right code is Q4012, that is for cast supplies, short arm cast, pediatric, 0 to 10 years, fiberglass. Because in the scenario, the patient is a 10-year-old male and it is a short arm fiberglass cast. So we are using the code Q4012. We'll eliminate option B, A4580, because that is for cast supplies, example, plaster. In the scenario, plaster is not mentioned. They have mentioned fiberglass cast. So we'll eliminate option B. And coming to option C, A4570, that is for splint. In the scenario, they have not mentioned splint, so eliminate option C. In option D, Q4024, they have mentioned short arm splint, but in the question they have given short arm fiberglass cast. So we have to code for short arm cast, that is Q4012. We cannot code Q4024. Eliminate option D. Option A is the right answer. Let us move on to the next question. What is the correct code for the supply of ganciclovir 4.5 mg long-acting implant? Let us check the options. Check option A, L8606. L8606 is for injectable bulking agent, synthetic implant, urinary tract, 1 ml syringe, includes shipping and necessary supplies. And option B, J7310 is for ganciclovir 4.5 mg long-acting implant. In the question, they have mentioned ganciclovir 4.5 mg long-acting implant. So, option B, J7310 is the right answer. We'll eliminate option A. And option C, A4650 is wrong because that is for implantable radiation dosimeter each. So that is not mentioned in the question. So eliminate option C. And option D is for infusion Pump system implantable programmable includes all components. Example, pump catheter connectors. So that is also wrong. Let us move on to the next question. Alice had to have a replacement for her soft interface in her protective helmet. How would you report this supply? Check option A, A8004, that is for soft interface for helmet replacement only. And option B, A8000 is for helmet protective soft prefabricated includes all components and accessories. And option C, A8001 is for helmet protective hard prefabricated includes all components and accessories. And option D, A8002 is for helmet protective soft custom fabricated includes all components and accessories. So among these four codes, which code is the right answer? The right answer is option A, A8004, because that is for soft interface for helmet replacement only. In the question you can see they have mentioned replacement for her soft interface in her protective helmet. So that is matching with the code A8004. We'll eliminate option B, A8000, because that is for helmet protective soft prefabricated includes all components and accessories. But here the patient has come for a replacement. So we have to code A8004. So eliminate option B. Option C is also wrong because that is for helmet protective hard prefabricated includes all components and accessories. But we have to code for soft interface in the protective helmet. Option C is not matching. Eliminate option C. And option D, A8002 is for helmet protective soft custom fabricated. But we already got the right code for soft interface in the helmet. Therefore, option D is also wrong. Let us move on to the next question. Which code describes an addition to the lower extremity knee disarticulation and leather socket? Let us check the options. Check option A, L5624. L5624 is for addition to lower extremity test socket above knee. And option B, L5640 is for addition to lower extremity knee disarticulation leather socket. And option C, L5105 is for below knee plastic socket joints and thigh lacer. And option D, L5850 is for addition endoskeletal system above knee or hip disarticulation knee extension assist. So which among these four codes is the right answer? The right answer is option B, L5640, because that is for addition to lower extremity knee disarticulation leather socket. So that is exactly mentioned in the question. Addition to lower extremity knee disarticulation and leather socket. Therefore, option B is the right answer. We'll eliminate option A, L5624, because that is for addition to lower extremity test socket above knee. That is not matching with the question. And we'll eliminate option C, L5105, because that is for below knee plastic socket joints and thigh lacer. That is wrong. And option D, L5850, is for addition endoskeletal system above knee or hip disarticulation knee extension assist. But here they have mentioned addition to lower extremity knee disarticulation. We have to code for knee disarticulation and leather socket. So we'll eliminate option D. Option D is the right answer.